New figures show that nearly 1 in 3 American adults has high blood pressure. The really scary fact is that many of you may have it, but you don't even know it. That's because high blood pressure has no symptoms. However, not knowing that your blood pressure is high could mean deadly results. Here to share with us more facts and information on this condition, as well as how to live a healthy life and reduce and even prevent the risks associated with high blood pressure, is Dr. John Bucek. He is family practitioner and the director of Somerset Family Practice Center. Welcome, John.
Hello.
How are you?
I'm doing well.
So talk to me about high blood pressure. We know that it's unhealthy. Why is it so unhealthy, and what does that indicate?
As you go from a normal blood pressure up into the abnormal range, your chance of dying from the effects of blood pressure goes up dramatically. For example, 120 is a normal blood pressure for the high number. 140 is associated with double the risk of dying from cardiovascular disease, from dying from a stroke or a heart attack. Double. So, and every 20 units of blood pressure that you go up, your risk doubles.
Wow.
So they declare normal is 120, and then your risk goes up with each gap. So lowering it is very important for those reasons.
So people that have the 180 and even over that are high risk.
Right. So compared to a person with 120, 2, 4, 6, they have about 8 times the chance of dying of a stroke, kidney failure,
Is that
disease.
what happens? Kidney failure is what happens? A stroke?
Yeah, your blood vessels, you have them throughout your whole body, arteries and veins. So as the damage to the blood vessel occurs from the high blood pressure, you could wind up primarily with heart disease, or you could wind up primarily with a stroke or cerebrovascular disease, or you could have kidney damage. So it affects all the organs. Some people tend to have signs in one organ more than the other.
Wow. So knowing those numbers is really an important thing. Can we talk a little bit more about those numbers? Now, what about the 120 over 80? Talk to me about that.
Yeah, 120 over 80 is considered normal blood pressure. And 140 over 90 is where they begin to say you have high blood pressure, you have hypertension. The gap from 120 to 140 is an area where you don't necessarily have to think of yourself as having a disease, but you should be more aware of your blood pressure, should check it more often. You should sort of start to think if there's ways you can lower it.
Now what about, the 120 over 80, can you explain to me what 120 means and then what the 80 means?
Yeah, when you use a blood pressure cuff to measure blood pressure, you compress the artery till it's closed. And the high number is the pressure at which the artery first is open. And then the low number is the pressure at which the artery is completely open. So it's the highest blood pressure in the vessel and the lowest blood pressure in the vessel.
So that's when I feel that thing on my arm, when my heart starts to beat in my arm, that first one is where it's starting, and then when it lets go, that's when completely open. So that's the high and the low pressures that you'll have in your vessel all day throughout the day. Now, how often should I check my numbers if I'm concerned?
If you know your blood pressure is normal because you happen to hear it at a checkup, you can check your pressure approximately once a year. That's often enough. If you know that you're a pre-hypertensive and your blood pressure is tending towards 140, or if you know your blood pressure is elevated, you really should have it checked every few months to see if you're getting worse or if the things that you're doing to help yourself are effective.
So only if I'm maybe at a risk point to do it more often, every 6 months or so?
You might find out at a blood pressure screening. You might find out, at work if they're going to give you a flu shot, and you go ahead and have your blood pressure checked before. However you become aware of it, if it's in the normal range, you're good.
You're fine.
You look at the risk factors in your life and maybe check it again in about a year.
It's funny because there's one of those little machines in my A&P. So when me and my daughter go to pick up our prescriptions, I'm always testing mine all the time.
That's a good place. Now, the maintenance of the machine may be an issue. If you see an abnormal number there, don't panic. Go ask a health professional. Go to your doctor and have them check your pressure for you.
That's great, though. So what age is a good age to start?
If you know for some other reason that your blood pressure is normal, most people do not have hypertension until over 60. Approximately 60 years of age, about half of Americans have high blood pressure.
Seriously?
Yeah. So if you know your pressure is normal, then you could, wait, maybe perhaps 30, 35, start looking at it more regularly. If you're from a family that many people have high blood pressure, you may want to look at it more regularly, maybe once a year, no matter what your age is.
That makes complete sense if you're in that high-risk category. Now, which leads me to my next question. Is it primarily genetics? What causes this? Where do we get
everybody has a blood pressure that's normal for their body. And unfortunately for some people, their normal blood pressure for their body as an adult is elevated. They have a genetic tendency to have high blood pressure. Their blood vessels, I guess you could say they're a little stiffer.
Okay, so stiffer would be
it's a useful description. Your blood vessels are very elastic. The cells are very springy. And throughout your whole life, they undergo wear and tear, and their ability to be elastic goes down.
Oh.
So in some sense, everybody's blood pressure gets higher throughout their life. Some people start at such a high level, or their tendency to have it accelerate is quicker, and that's a family of people who might have high blood pressure.
So as we get older, they tend to just get more worn out. I should say.
There's friction, inflammation, all the different things that we do to ourselves during life. And then there's certain conditions. For example, smoking can irritate the lining of the blood vessels, make it more likely that you have high blood pressure. Being overweight causes inflammation that damages blood vessels. Specific infections might cause injury to blood vessels. So there are things that make it go faster and be worse. But your tendency to be hypertensive, really, it happens at birth.
Primarily a genetic situation. Yeah. Is there a cure for it? Is there any way we can get cured?
Anybody who has slightly elevated blood pressure can use lifestyle changes and basically not need medicine.
Okay.
In that sense, they're never going to have the disease. But if you have a tendency to have high blood pressure, you may not really ever get rid of that tendency.
Really?
So you could control your risks, don't add to your risk, but the idea that you might get rid of your genetic tendency, no.
Not going to happen.
No, so be always on top of it.
So people with those specific genetic issues, it's going to be majorly important to worry about things with my health.
Yeah, I mean, if they're going to have an increased risk for their whole life of a blood vessel disease and they can be aware of it and perhaps reduce the risk, I think it's a very, a high payoff for their awareness.
Okay, so let's talk a little bit about more how to reduce those risks. Let's go over what can I do to keep those risks down.
Exercise is one of the main things.
Okay.
The more you exercise, the better the blood vessel health is, I guess you could say. Okay. So you're going to reduce your chance of having a heart attack, stroke.
Right.
Watch your weight. Even if you're not an exerciser, if you're overweight, you're going to accelerate your chances of getting high blood pressure or make your high blood pressure worse. Some people have a high blood pressure that's responsive to salt. Others don't.
Right.
You may want to look at your salt intake. I think about 2.5 grams of salt a day.
Is it?
Yeah, and you could get that easily. If you look at processed foods, they have considerable amounts of salt in them. Sometimes one dinner can have like 2 grams of salt.
I look at that all the time. And even I don't want to say the names, but the little boxes, the microwavable.
Very high in sodium.
Huge
You're looking for the word sodium in particular when you're looking for your salt content on labels.
So keeping all those things in check. Now, does exercise keep my vessels strong? Is that what it's going to do?
It helps the repair process.
Okay.
It helps the chemical process that keeps them springy, I guess you could say.
Okay.
So people who exercise, some of them don't need medicine, so they exercise and they actually reduce their blood pressure. There's some well-designed studies showing that you can reduce your blood pressure, 10, 15 units by being a regular exerciser.
Just by being an exerciser.
You can delay the date that you get high blood pressure, all those things.
Now, what if I don't have that and I need medication? What do we do there?
If you need medication, many people wind up taking only one medicine if they have mild high blood pressure. But if your blood pressure is over, let's say 150, 160, you often wind up taking more than one medicine. And if you wind up on a medicine, it's often for the rest of your life. You take a medicine once, twice a day for the rest of your life. So it's a significant impact on your style of living, too, to have to buy the medicine, take it, worry about side effects.
All that. Now, we're running out of time a little bit, so I just want to touch base on what are some of the misconceptions about this?
Well, you don't really feel anything. It doesn't hurt.
Right.
You don't feel uncomfortable. Some people will get headaches or vision changes with very high blood pressure, but since it doesn't affect you and you don't have symptoms, many people don't think they need to attend to it, even if they heard they had high blood pressure. I think that would be something I'd like to sort of get across is if the number's high, the number's high. It doesn't matter. If you feel good, you should look into it. Some people take medicine, the number goes down, they feel better, and they think, oh, I don't have to go, take my medicine every day. And it's an unfortunate thing that unless you lower it through exercise or diet, you really might wind up taking your medicine every day.
Really?
And don't miss it.
So you really want to keep the checks and balances always there in place.
Sure, and your physician will get to know you. They'll want to see you more often when they first start the medicine, perhaps even every month. And then later, once you know the medicine and they know you, it could be as infrequent as every 6 months that they'll check your blood pressure for you.
Really? Okay, good. Well, thank you so much for all your information.